first inductee for the 2010 Healthcare Marketing Hall of Fame Awards is going to Dr. André Lalonde. And to present to Dr. André Lalonde, I call upon Mr. Terry Davidson. Terry.
Cliff got me on the phone when I was raking my lawn, which is what I do best these days. And I haven't been in the industry for a few years, and coming here, it's very, very nice to see a lot of old friends and colleagues. But anyway, Dr. Lalonde is off to Haiti shortly, and time is of the essence with him. Anyway, my name is Terry Davidson, and I'm here to introduce Dr. Lalonde, the Executive Vice President of the Society of Obstetricians and Gynecology of Canada. The face of obstetrics and gynecology in Canada has changed for the better, in large part due to the contributions of Dr. Lalonde. Dr. Lalonde got his first taste of administration when he was Chief of Obstetrics and Gynecology at LaSalle Hospital, General Hospital, a community hospital in southwest Montreal. He directed the department for 20 years and became the president of the hospital board of governors, which is rare for a physician to do. He was able to organize 2 expansions of the hospital, including the creation of the first birthing unit. It became the reference center for new approaches to maternal health. This interest in administration led Dr. Lalonde to pursue a master's degree in health planning and financing from the London School of Economics in the UK. Dr. Lalonde began his affiliation with the SOGC when he arrived in Ottawa in the early 1900s. He developed strategic plans and began to develop a lot of win-win relationships with the pharmaceutical industry. A win-win relationship because the industry was permitted to attend scientific sessions to make sure that they had an opportunity to increase their education levels. And the funding enabled the SOGC to deliver high-quality programs to their members and the medical community. Dr. Lalonde also realized the industry funding was a two-way street. So companies were permitted an opportunity to relate the benefits of their products through scientific sessions, while the SOGC maintained a high ethical content of these programs. One of Dr. Lalonde's initiatives helped standardize the delivery of gynecological care in Canada. He created a clinical practice guidelines committee at the SOGC that surveyed the delivery of obstetrics and gynecology care in Canada with the aim of standardizing all these cares across the country. Canadian physicians at the time were practicing local, American, and British guidelines. Medical legal costs were rising in Canada due to the high incidence of high-risk births. The SOGC, under the guidance of Dr. Lalonde, developed protocols to ensure fewer complications would occur in high-risk situations of labor and delivery, with the result of better control of these costs. Dr. Lalonde and the SOGC are leaders in implementing treatment guidelines, having the greatest number of sets of guidelines amongst all specialties in Canada, resulting in a better prenatal health care for newborns and mums. Dr. Lalonde's efforts did not stop at the Canadian borders. The SOGC has implemented a program of international women's health care. These initiatives have been implemented in Uganda, Guatemala, Haiti, and most recently, Burkina Faso, to raise the standard of health care for these women in these countries by taking the programs and adapting them to the low-resource countries with a goal of upgrading the skills of midwives, nurses, and physicians. Dr. Lalonde has helped, the SOGC have helped to increase the quality of obstetrics and gynecology care in Canada. Their efforts are now being put toward public awareness programs about the use of drug therapies during pregnancy and identifying drugs that may have tetragenic effects. In addition, they are also studying the issue of infertility and the barriers to access fertility treatments in Canada. Andre has a few passions in his life. One, his wife Lisa and his children. His very impressive wine cellar, if you ever get to see that, it's great. Golf, and doing everything he can to improve women's health in Canada and across the globe. So Dr. Lalonde, thank you.
Thank you very much, Terry. Thank you for the committee who have proposed this award, and thank you all for being here today. I'm really honored to join this Hall of Fame. I think that in Canadian healthcare, too often it is forgotten the role that the research-based pharmaceutical industry has done in Canada in terms of research, education. I come to work with the industry for over 20 years now based on one principle, that is partnership. Through this principle of partnership, we're being able to do some great things, great public campaigns throughout Canada, and we've raised the standard for Canadian women. Thank you very much, and I'm leaving you now to go to Haiti because our society is supporting one of the maternity hospitals, which we're able to recuperate 3 days after the earthquake, which is now functioning, so I leave later this afternoon to help them. Thank you.